What's become standard is to do, for many of the tumor types, is to do pretty selected genetic testing or molecular testing of the tumor. So for example, if it's a medulloblastoma, or looks to be a medulloblastoma under the microscope, the pathologist or the molecular pathologist might also do a few specific gene tests or do what's called expression profiling or do some other tests to try and figure out, for example, which molecular subtype of the 4 common subtypes of medulloblastoma it is. And for other tumor types, it's similar, that there might be some, depending on what the actual clinical question is or what the tumor looks to be, there might be some specific tests that are indicated. So for example, in pilocytic astrocytomas, which is one of the common types of brain tumors in kids, they often have either mutations or different types of genetic alterations that occur that affect a gene called BRAF. And so doing some type of BRAF mutation testing is pretty common for patients who have pilocytic astrocytomas. So most of the testing that gets done routinely today is based upon what the suspected diagnosis is. So it's not just like a huge amount of testing, doing all these different genomic tests and all these different sequencing tests. It's usually pretty focused. And that's the type of testing that gets done standardly. So the more broad genomic testing or exome sequencing or those things, those aren't standardly done. The questions I would be asking if I were a parent would be, a lot of this testing that I'm talking about is still kind of as part of clinical trials and experimental. So I'd want to know that the lab or the physicians that were taking care of my child at least had some understanding of what types of testing are done as part of standard clinical care. And most of that's something that should be standard at places who take care of children with brain tumors. But then the next question, which is more related to availability of clinical trials and experimental treatments and things that might be done, for example, for kids whose tumors don't respond well to treatment or that come back after treatment, that some of these more kind of experimental approaches related to genomics might be things that are useful or interesting. It's pretty unusual by doing this sort of testing of tumors that we would find something that changes kind of the upfront therapy for patients, which is, I think, important for parents to know. Most often, it might refine the diagnosis a little bit, or there might be some cases where, based upon the pathologist looking at it under the slides under the microscope, they're not quite sure whether it's one tumor type or another tumor type, and sometimes doing this kind of genomic or molecular testing can help with that. But in the vast majority of cases, really what we're talking about is information that might be useful if the patient's or the child's tumor comes back or relapses or something that, our standard treatment approaches, kind of some of the chemotherapy and radiation therapy haven't worked. Because then that's the scenario where we're really trying to get all the information we can about the patient's tumor and consider all different types of treatment options and figure out what clinical trials might be most appropriate for that child. We've learned so much about the genetics and biology of the brain tumors. It's all very exciting. And there's so much kind of in medicine in general and in cancer treatment in particular, there's so much excitement about personalized medicine approaches, precision oncology approaches, basically approaches where by doing some testing of the specific patient's tumor and maybe their blood, they get a very specific treatment plan based upon those characteristics of their individual tumor. It's a very attractive concept because ideally we like to give the most effective therapy that's the safest for each patient, and we're working towards that. But the reality is that at the current time, we're still in the phase where we're learning how to use this information.